Ladies and gentlemen, welcome to another episode of Homefront, where we bring that information to your homes and make it so very entertaining. My name is Rome, and I'm going to be your host as usual, as you would have seen me all season long, because we're in season 2 and we are so excited. So today, I'm joined by a very special lady who is the head of the department at the Eric Williams Medical Sciences Complex. Which department that is the Pediatric Emergency Department. Ladies and gentlemen, as we welcome with us today, Dr. Vidya Ramcharitar Maharaj. Doctor, welcome.
Thank you very much. And you got the name perfect.
All right, great. We start on a good foot.
Very much so.
So today we're going to discuss a bit about first aid kits in the home, because in terms of the pandemic, we know that a lot of the kids are now home doing online schooling, and then they're playing with their siblings, and then we know the usual boys and girls interacting. They may fall, they will get cuts and bruises, even burns. So the different aspects of injuries that they could get in terms of addressing them with the first aid kit. So we're going to dive in today, and this is your personal first aid kit from home?
Yes, it is. And this is the present that you are going to open today.
Okay. So we're getting ready to do an unboxing. All your social media influencers who are custom unboxing, we're going to do an unboxing of our first aid kit. So let's start. I'm seeing at the top here, we have tweezers.
Yes.
So so this is what?
So just in case you want to, eyebrow.
The eyebrows.
On a more serious note, this is actually for splinters. So, sometimes a glass may have fallen, you would have thought you got most of the pieces out, but they're running around, they don't have their slippers on, and something goes into their foot.
Right.
So they will feel it, and sometimes you may not be able to get it out with just using your hands. So a tweezer, and this is very fine point. So that you
also,
can actually get
it.
You have different sizes. So if you can get one, you want to get one that is that fine point.
Tip.
If you don't have that, I mean, some people tend to use like a needle and try and dig it out. That was what we would do old school. But sometimes you can cause more injury when you're trying to dig it and get it out.
I remember as a child, I was probably one of the wildest young boys you would ever meet.
Really? Yeah, I wouldn't think so.
You wouldn't guess
Not
it,
at all.
because I'm so calm now.
Yes.
And anything that went up into my feet, my mother would take a razor blade sometimes, and she would cut off the top of the skin and then take a needle and then go inside. But she would heat the needle first. And then she would go inside, and I would cry and cry.
You're crying before it starts, I'm sure.
Yeah, before she will touch me, I don't cry because I know
sounds like a boy,
coming.
very much like a boy.
So this is better to use.
So this one is, or if you don't even have that, sometimes what people do use is be like an adhesive tape, and you can actually put it over and try and hopefully pull it out.
All right.
And even glue, like if you put like crazy glue, because it will harden, and if you can peel off the crazy glue, the splinter may actually come off with it as well. So those are other ways. If
remedies. All right. So we have the tweezer. I am seeing, what is this? A steri strip.
Steri strip. So you can actually open it, so you can actually see. And as you can see, it's like little Scotch tape. So like when you have any sort of cut, and if it's very superficial, to stick it back together, you can actually tape it together.
So this is like a stitch.
Instead of stitching, we can actually, because not all cuts will need stitches.
But it will help to bring it.
Or if you've had a very deep cut, but you're getting into hospital, and you've cleaned it, you can actually then put these on it while getting into hospital.
All right.
So you sort of secure it.
Okay. iPads.
Yes. So this is, sometimes where they're running and something blows into their eyes and it's watering and they may have gotten like dust into their eyes and you're trying to get it out. But because you can't fully get it out, anything like looking at light or anything irritates them.
Right.
So if you put this eye patch onto the eye, it soothes it because they're not looking at light while you're getting them to medical care.
So getting something out of a child's eye, first of all, I know back in the day, people would just hold the eye open and they would blow it.
Or they would blow the edge of your jersey and then put it on it. I still do it for my little one, It's
so
like
also that's like a remedy. So people would actually...
It's more just the heat of it that you're actually getting to sort of soothe it. It's more soothing. But it doesn't really blow it up because they tell you don't put your hands into the child's eye, don't put anything into it. And sometimes the eye itself can actually work to get it out because they'll just water to try and wash it out.
So could you hold the eye open and put water in it to get out whatever?
So depends on what water. We in the hospital would actually use normal saline to actually wash it out. Remember, the water, you're not sure what bacteria it has, you're washing into it. Now, you can still wash it if there's a chemical that's gotten to the eye. And that also you have to be careful because some of the chemicals get worse with water.
Right.
So it all depends on if you know it's just dust particles. Yes, you can try and get it to wash out. But at the same time, if it's still running water, it's still irritated, get the child into hospital so that we can actually take a look at it.
Okay, so that's the eyes. Now I am seeing, this looks like what? A Band-Aid?
Yes, crepe bandage. That's what it's
Crepe
called.
bandage. Right.
So yes, so you know sometimes where if you've gotten a sprain, so there's different sizes. So when you explore a little bit more in the kit, you'll see other sizes as well.
Right.
And what this does is sometimes you can wrap it. So if you have a cut and we have put a piece of gauze onto it, I can wrap it like a bandage. So it secures in place and gives it a bit of a compression.
Right.
Yeah. Or if you have a sprain, let's say a wrist sprain or even an ankle sprain, and you need it to just be reinforced, we can actually crepe it to sort of help with sprains.
All right. Well, you mentioned gauze, so these are the gauze. So I'm guessing this is to absorb the blood?
Yes, to clean it. So when you're cleaning as well, you can use it. Now, these here, now you can use rubbing alcohol, so you'll have that separate in your cabinet,
so
or you actually have these little pads, which you can
What about
sometimes use
alcohol? Because I know, so if you have a bottle of punch,
I thought you were going to bring in the punch.
Yeah. Would that work?
It is alcohol. You can't put it on to clean it, but I'd prefer you use mentholated spirits and rubbing alcohol.
Mentholated spirits or rubbing alcohol.
Because I'm not sure the child would have drunk it if I'm smelling it and it's not there.
So if not, then you can hit the punching.
If you have nothing available and you have to clean a wound, yes, but that's not ideal. The ideal thing would be...
What about salt? They always say you're rubbing salt into the wound.
No.
So salt doesn't...
No, that will burn tremendously.
So the salt just burns? It doesn't like clean
because you hear me say I use a normal saline solution, it is a salt solution, but it's a concentration of the solution. So I'll make sure it does not burn when we clean.
Okay.
Just putting raw salts,
But does salt heal a wound as well? Because some people say if you go to the beach or you go to the sea and you take a sea bath, it helps to heal wounds. Is that really?
It comes naturally to us. Unstoppable energy. We use it to manifest a future. A future where energy takes new forms and is used in new ways for all of us. The new age of energy is here.
Because some people say if you go to the beach or you go to the sea and you take a sea bath, it helps to heal wounds. Is that really true?
Because salt hardens tissue. So just like how, if you tell you have an injury in your mouth and you will tell you gargle with salt water.
Right.
Salt water does help because it helps to harden the tissue and to help it to be to mesh better.
Okay.
Even like when you have injuries in the groin area, especially for women, they would usually say do a sitz bath. So sometimes when the little girls, if they have any sort of cut or injury at the vaginal area, we would say do a sitz bath, and we would use Epsom salts.
Right.
So not all salts are the same. So you can't just say, okay, I'm just going to have salt, I'm just going to throw salt on this.
Right.
It differs according to what we would say and what we would do.
Okay, so you're cleaning with the alcohol pads or rubbing alcohol or mentholated spirit.
And you also have iodine ones.
Iodine,
So this is also an antiseptic. So then you can actually put the iodine and then you clean with alcohol.
There was something they used to refer to as iodex long ago. That's the same thing as iodine?
No, but it has iodine in it, but it's not the same thing as the iodine pads.
All right, so the iodex, but I don't know if it was a brand. As a child, mommy would say, go and bring the iodex, or she would say, bring the Savlon or the Dettol. I guess those are
all antiseptics. So Iodex would have been a foam, which was an ointment that you can rub onto things. So usually when somebody falls and there's a bump on the head, they'll rub it with Iodex.
Right.
Because they just think, okay, it's going to heal, it's going to help it. So it's the same sort of antiseptic concept. It's just a different media in which the iodine is prepared.
Oh, so iodine. So all those three things I just mentioned, all of those have iodine.
Antiseptic. They don't all have iodine, but they're antiseptics. So Savlon wouldn't have iodine, the Iodex would, but Savlon and you mentioned one other,
Dettol.
like Dettol. Those are all different antiseptics. They don't have iodine in it, but it has a form of antiseptic.
Okay. What is this?
Oh, that's my concoction. So, this is actually saran wrap. plastic wrap. So I put it on this and wrapped it because you wouldn't exactly have a whole saran wrap rolled in your kit. But if a child gets a burn, a hot water burn, you would want them to run cold water on that burn for at least 10 to 15 minutes because you want the area to cool. Now, you're not going to be putting any butter on it. You're not going to be putting any Vaseline, no toothpaste, nothing like that. There is a certain cream, which is in the bottom of this. So let me see if you can find it. And it's actually called a burn heal cream. So as you dig up into it, and it's basically like a silver sulfadine.
Right.
And what that does is that it helps to coat it. So that one, yes, perfect.
Right.
So this here is the cream that you actually put onto the burn area.
Okay.
Yeah? And then because you may have to carry the child to hospital, you don't want to wrap it with the crepe bandage because then for me to see it, I have to unwrap it, which is more pain for the child because I'm interfering with it. But if you wrap it with this, it's clear. I'll be able to see the area.
Okay, so your first step is run cold water, and then you put this cream, and then you wrap it with the saran wrap.
Yep.
Right.
So then I can see the area.
Would this stick onto the burn so that when you remove it, pieces of the flesh comes out or pieces of the skin come out?
No, it doesn't.
No, okay,
it doesn't.
So
it's actually not sticking to the skin at all. Yeah.
Okay. And this, you said hot water burns. What about burns from oils or from a fire?
Anything.
Any sort
like
of burn?
that. You will want to run hot water because cold water onto it simply because you want it to be cooled.
Okay.
Yeah, you're taking away the heat. So that's why I have a bit of this on a piece of stick.
All right. So we have, let me lay them out. This is our burn cream, our tweezers. We had our iPads. Right. What is this?
What do you think it is?
It looks like some sort of inhaler.
That's, and you use that with the inhaler.
Okay.
So this is called a spacer. It's an aero chamber, they would refer to it as. So this is the part that goes over mouth and nose. And then this is the part into which an inhaler would fit. And that's like this inhaler here.
All right.
Right?
Well, we're coming back to the inhaler. We're coming back to the inhaler because I want to get into depth with this. And this is the other size to the crepe wrap. This is looking like something with buttons and pins that my mother would have.
No, you probably find it in a lady's purse, however.
Oh, okay. This is
Did I see you go red just now?
I guess this is sanitary napkins.
Yes, it is
All
a
right,
pad.
okay, so sanitary napkin.
But you're not going to ask me
But
why?
why is it in a I'm not gonna I'll put it down. Like, why is it in a first aid kit though?
Okay, so do you know these recent pads, sanitary napkins, can absorb a lot because of their extra absorbent nature? So if you actually get a very bad cut and it's bleeding quite a lot, you can actually wrap this because it will control and it will absorb blood.
Oh, okay.
So when my son was doing taekwondo, that was part of the kits because if they get injuries and there's bleeding, we have something. Instead of using gauze and it's bleeding through, this will actually
absorbent. Yeah, okay, makes sense. Makes sense. All right. Paracetamol syrup.
Yep, that's the famous what everybody knows as Panadol, Aramol, Tylenol. Paracetamol is the actual drug. So that would be for fever, that would be for pain. So if you have burns, you're in pain, we'll give you the paracetamol. If you have fever, then we'd use the paracetamol as well.
All right.
But you have to know that different brands have different concentrations. So if it'll be 5 mils in one, but it may be 7.5 mils in another, or it might be 1.5 mils in another.
Okay,
So
you have to know
as a parent is to make sure that you're not just going with the mils, but you actually know how much and which one it is that you're using.
allergy syrup.
Yes. So kids home, they're getting into things that they may not supposed to be getting into. Or next thing you know, they're outside playing and they get stung by a bee, and then you get an allergic reaction. What's an allergic reaction? That would be where you actually get hives, where you see the redness, the bumps, the scratching, the itching, or you may actually get the swelling going around in the eyes, the eyelids, the mouth. So you want to stop that reaction. Those sort of descriptions of the mouth and the eye swelling needs to get into hospital, but you can sometimes give them that allergy syrup, which people know as Piriton or Histal Elixir.
Right, I know it as that.
Yeah, so most people will know that, just like any pen is a Bic.
Right.
So
we know it as a brand name versus what it really is,
we
right?
do indeed.
And finally, quickly, I'm seeing hydrocortisone cream. What is this?
That's a steroid cream. So it's a steroid ointment. And that is basically if you actually have bites and you're itching, then you can actually apply this cream to help.
So like ant bites, a bee sting,
Yes,
all of these
you can
things
topical.
we can use. Topical.
Yeah. Topical.
On top of it. Okay. All right. I'm seeing here some other antibiotic cream.
So if you actually get a cut or if you scratch and you have open wound, after you've cleaned it, you can put the antibiotic ointment.
Cream. Right. And I'm guessing this is to make a sling.
Yes, it is.
All right. So we are going to take a pause for mindfulness moment where you take a breath of positivity and breathe out all of the negativity. And when we come back, we're going to go deeper into the inhaler.
Hello and welcome to another mindful moment. Today I'm taking you through another breathing technique, and this one is called the 4 square breath. It's a really good one for people to help us focus our mental attention and clarity, and especially one of my favorites because whenever we are in this age of Zoom and looking at pictures of our friends or colleagues, it's useful to kind of trace around their picture on the screen. So the way that it works is as we draw an imaginary square with our fingertips, whenever we go up, we breathe in, and then we hold our breath as we go across, and breathe out as you come down, and hold your breath at the bottom. Okay, so we'll go like this. Breathe in, and hold, and out, and hold. Good job. And breathe in again, and hold, and out, and hold. And so this can be one that you trace out in the palm of your hand, for instance, if you're remembering to breathe before taking a test or an exam. I like doing it, as I said, when we're on Zoom calls as well. So remembering to use your breath as a powerful tool to help you focus and to be here now.
It's Rome, and we are here. We're chilling with the boys. We're liming with the kids. We're doing this all for the PED CARES Foundation. So we need you at home watching us to go donate. Head over to the pedcares.org and send that donation, whether it's via credit card, direct transfer, because we want to make sure that the kids of our pediatric emergency department get the best possible care that they can get, because we need to take care of the next generation. The future lies with the kids. You all ready? On three, we go and say yeah. 1, 2, 3. Yay! The PED CARES Foundation. And we are back from our mindfulness moment. But Dr. Vidya, in terms of this kit, I didn't see Vicks. And I knew when I was growing up as a child, one thing every 3D parent thinks is the solution for anything can happen to you. Rub some Vicks on your chest.
True, but the Vicks is always on the nightstand and the table, so it's not in the kit, so the kids can always get it.
Right.
So Vicks is something that, yes, we've grown up with. I remember saying, I have a toothache, take some Vicks and swallow it, it will help. Now, that's not what you're supposed to do. So I was like,
your mother dread
I tell you, when I became a doctor, I was like, my God, I'm lucky that I'm still alive. But these were the things, because this is what we knew. Now, I still use Vicks, but I use it in such a way that I will put it in hot water so that it create a vapor or a mist, and therefore you can just inhale it. So it helps with congestion. Most people now will have their humidifiers, so therefore they can actually put that. And Vicks has their own humidifier.
Okay.
They have their own brand, so you can actually use that. But
so it clears up congestion.
It helps with the congestion. The vapors help. It's the steam as well.
Right.
So it's not just that it is you put it in any water. It's the steam along with the vapors. The menthol sort of helps when you actually breathe it in. So, but when you have a humidifier or diffuser, it's actually just doing the room, not directly here.
Right.
So that's why sometimes you would actually say, put it in hot water, put it in a bowl, put a rag in, wring out the rag and hold it close. Right. So the steam would actually help.
Okay.
Yes.
And as we're speaking, inhaling, we have our inhaler.
Yes.
All right. And when do you use an inhaler? What is in the inhaler? What happens?
Right. So the inhaler has actually, there are different types of inhalers. The one that we have here is what everybody knows as the salbutamol inhaler. And this is particularly used for children who have asthma. out. When children are having an allergic reaction or when they've had a bee sting, they may also wheeze. Then this will also be used when you go into hospital. You will see us give a nebulizer.
Okay.
Yeah. So this is the inhaler. Comes apart, parts like this, here, and then when you spray, you actually see it's there. And with this, as you can see the parts, this fits over mouth and nose. This will fit into the chamber here. And then when you put it, remember, sorry, I forgot to tell you, you have to shake this really well.
Right.
And then when you put this, one spray, and they breathe for 10 seconds.
Breathe.
1,000, 2, 1,000. And then you follow instructions from the doctor as to how many puffs and how regularly that you will
So
give
if you
it.
don't have one of these, could you just use the inhaler by itself?
Directly. For an adult, yes. But even in adults who are in respiratory distress, it's very difficult for them to take a deep breath in, blow out, and then take a puff and hold the breath. When we didn't have all of this, when I was a baby doctor, what I would tend to use, or what we were told to use, the old chubby bottle, and we would cut the base and create one by putting the mouth of the chubby bottle in hot water and form it around this. Or if not, a Saratex cup, cut the base, stick it in, and you have it like that.
Okay,
yeah.
okay, and that helps. All right.
Yeah.
And so a child who is not asthmatic, would they have an inhaler at all?
No, not necessary. So that's why this one, I put it in for those children who are asthmatic, so we go through this, because this is an important part of a first aid kit for a family that has children with asthma.
All right.
But not every family would be expected to have one of these.
An inhaler.
Yes.
And as we know in Trinidad and Tobago, the vaccines are a hot topic, and in terms of we're talking about kids, we're talking about children, and we know that the vaccines have been approved for children 12 and over, but still, there's still a bit of vaccine hesitancy in that group, not because of the children, but it's the parents who have to give the permission for the children to be vaccinated. And why do you think this is?
I think part of the reason is that it has been a new vaccine. It is also a method of preparation of this vaccine that parents are uneasy with because it's not like the other vaccines you've been giving the children all the time. I think also because it's a lot of social media and you're getting a lot of reports from different countries. Long before, everybody just knew you have to go to school, you have to take the vaccines. There was no question about it.
Right.
But this is a sort of information generation. So I'm getting all this information, how do I assimilate it? And part of it is that they're confused with listening to what doctors are saying, and then, as they always say, there's Dr. Googles. And that's where the conflict is coming in. A lot of times, though, I have parents in the office, and I did a talk about vaccines for that age group and the side effects and everything, and I go through it with them. But also as well, I find the children are actually saying, I want the vaccine. And the parents will go, well, it's their choice, and we have spoken to them about it, and they want it. So part of it is the parents, they're just uncertain about it, and it's because they now have to make a decision for their child, and how is this going to affect my child? I will be not around in 20 years, but my child is still young. Is this going to affect my child in that time? And that's a concept that's going through, but they're not understanding that a lot of times when the vaccines first came out for things we know like polio, it was new at one point in time, but it saved lives. And this is also new now, and 20 years from now when they look back, it may be that that was saving lives as well.
Yes.
So we learn from history.
Yeah.
Yeah.
And do you think that if we had a conversation with both the parents and the children together, that would help to to reduce the hesitancy?
I think so, because you're giving them both information at the same time.
Right.
So when they actually get the information, and it's put in such a way where they can see dangers of getting the infection versus the vaccine, and a lot of people are worried about the myocarditis. That's the main thing. And when myocarditis, how it's going to affect my child's heart. And the fact is that if you get the infection, you're 6 times more likely to have myocarditis, your heart being affected, than if you get the vaccine.
Right. So you all heard it directly from our doctor. Thank you very much, Dr. Vidya, for joining us today. This has been another great episode of Homefront, and thank you very much to our PED CARES Foundation family. Remember to go donate, donate, donate. We are doing this for the children to make sure that we have a great future in Trinidad and Tobago. And thank you very much to Dwellings for a beautiful set here as usual. My name is Rome. Thanks for joining us.
It's
All
perfectly
right, great. So welcome, Doc, on
Thank
set.
you very much.
Was that it? Yeah, cool.